mental status is basically just a review that you kind of conduct with all of the clients. It involves a brief checklist of the status that the individual currently is at, and it should support the diagnosis. So to begin with, you have to judge the individual based on their appearance, whether they are well-groomed or poor-groomed, whether they have makeup or unusual clothing or they're overweight. There's also attitude, which includes describing the way they behave towards you. And examples of this can include that they're guarded or seductive or cooperative or belligerent. There's consciousness, which is their level of alertness, like whether they are clouded, drowsy, or unconscious. There's orientation as well, which involves questioning whether the person is aware about who they are and the other people present and the place that they are in, whether they are aware of the time. And if they are aware of people, place, time, then we would write down oriented times 3. Memory is another important thing. So we have to detail whether they can recall short-term memory, long-term memory, or things that happen immediately in immediate memory. Psychomotor activity is another important detail where we have to detail any abnormal movements in the patient, such as there could be retardation present or nervous tics or agitation. Speech is important as it details any unusual tone, rate, or volume of speech, such as there could be rapid or pressured or barely audible speech or slow holding or high-pitched speech present. There is also mood, where it can be seen through observation or self-reported by the patient, such as, for example, the individual might look depressed, calm, angry, or anxious. There's also affect, which needs to be considered, and that involves that the mood is being expressed, such as it could be in the full range of emotions, or it could be quite restricted, only having one or few emotions, or quite blunted, having muted emotions, or being quite flat, having a lack of emotion, or labile, which is rapidly swimming between emotions, and inappropriate, whereby the context does not match. There's also perception to consider, where the individual might be perceiving things that are not there. There might be visual hallucinations, auditory hallucinations, derealization, or depersonalization. One also needs to consider their thought content, which is to note down any abnormally expressed ideas, such as a persecutory ideation, homicidal ideation, suicidal ideation, delusions, or ideas of reference. There's also thought process, which needs to be considered, whereby we need to note down any issues in the train of thinking that the patients exhibit, such as being goal-directed, like sticking to the topic, circumstantial thought, where there is too much excessive detail about a certain circumstance that occurred, tangential thought, where the individual keeps going off topic, loose associations, which is jumping from one topic to another with no logical pattern at all, well, not apparent for the therapist anyway. Perseveration is the returning to the same topic continuously. We also need to consider the patient's judgment ability, whether they're making sound decisions in a certain social situation, and if they fully comprehend the consequences to their behaviors. We would then make a judgment of whether it is poor, fair, or good. Finally, there's insight to consider, which involves the degree of awareness the patient has for the illness that they have. And that's kind of what we look at in a mental status reporting. Thank you very much. Bye-bye.